Let me just set the ball rolling by one question to David Nicholson. David, you were very frank about the need for the NHS to be more open to innovation, and the Innovation, Health and Welfare report from Ian Carruthers is very important there. If there's in this room a company, someone who's got an idea, a new molecule, a new drug, perhaps a new device, and they're finding it difficult to get it into the NHS, what should they do?
Good question. I mean, you're absolutely right about where you know, I described how we're trying to change the way we operate, and we are on that journey in that sense. And there are a couple of things I think that will make it easier for people in the future, but we just haven't quite got there yet. The Academic Health Science Centre networks, I think, are critical to all of that. So for business there, you have, all right, 15 or 16 places to go, but at least you have that number as opposed to the 250 you might find yourself trailing around in future. We have to think about how we pull all of that together, but that's one way. And also the next phase of work that Sir Ian is leading is on the procurement practices in the NHS. We've had a call for evidence from industry about how are our procurement arrangements being put in the right place. What I would say, if there are particular issues at the moment, Sir Ian is here, and he's over there. He'll wave your hand, Sir Ian. Yep. Talk to Sir Ian. Hi. Talk to Sir Ian. Particularly, I think, because as we're trying to design the way of interacting with business, we can design in the issues. If you've got stories about difficulties or whatever, Ian will be really happy to talk to you about them, because when we finally construct this arrangement, we want them to be absolutely in the right place for business.
Very good. Now, I think we should now turn to you. There's a quarter of an hour left, and we have a roving mic. Who would like to put any questions? Yes, and do, of course, identify where you are from, your organisation, please.
Thank you. Stuart Fletcher, Chief Exec of Bupa. A lot of the conversation today has been around what I call relieve and cure. And there has been some mention of prevention, but it's in that context I have my question, which is, how do you see us progressing a deep understanding of how to achieve sustained behavioural shift at the individual and societal level in pursuit of prevention, both primary and secondary prevention? How are you seeing the funding of that? How are you seeing the approach of that?
David, do you want to come in?
Only that it is increasingly a kind of the bit of the jigsaw that is missing. Certainly if you look at our system and the way we identify guidance and good practice and all of that sort of thing, it is kind of missing in that system. And I think clearly, I think Ara talked yesterday, was it you talked yesterday about research and development in this area and how important that was. Ara want to talk about that a bit, but it seems to me that's a kind of key part of all of this, as Jeff Mulgan as well talked about it in the thing yesterday. That, I think, is the place we need to go. Do you want to comment?
Yeah, that remains a challenge globally, to be honest. It's not purely an NHS issue, and the simple reason is most of our healthcare systems have designed and continue to provide what the needs of the last century were. And you know, they're designed as a sickness service, not a health and a well-being service. And I think that needs a leadership from the top. And I think in a way we're seeing it certainly in the NHS by separating the NHS into the commissioning board and getting the department to truly concentrate on not just the public health, but you know, and I did mention behavioural economics, and we are fully aware of the government's interest in behavioural change. And that brings in completely new sets of skills of what is the norm, and it's no longer adequate to say, you know, let's reduce the smoking rates or the alcohol intake. Oh, we still need to look a lot in smoking, but this is a much bigger area. And I think also you will probably know with the new health and well-being panels, which is part of the new delivery of healthcare, if we engage local government, because this area isn't really only in the remit of David. This is cross-sectional thing, so it needs a cross-leadership from different ministers to bring that in. So I think we have certainly the starting points for this.
I mean, we're very proud of our multidisciplinary science base, and it ranges, we call it science, but it includes social science and the humanities. I'm trying to give you an example of what it does. There was an excellent piece of research by some social scientists on obesity who identified that one of the issues was that if you ate quickly, then you were more likely to feel hungry than if you ate slowly, and then applied that to the way in which we were designing and running our schools, where the schools, the size of the school dining hall was shrinking, as a result of which you needed 2 or 3 sessions for the kids to eat their school dinners. And the schools were under such time pressure on the curriculum that they were shortening the time of the kids' lunch break, and the shortened lunch break was associated with them then going out to a local newsagent or whatever and buying a Mars bar. And so we have, it's one of the strengths of our research base is precisely it makes these kind of connections between a range of disciplines. And we do try in our leading universities and research centres to bring together a range of disciplines.
It's the size of the plate as well, Minister. That's why we have a small place today.
Yeah. Yes, over there.
I am Carlos Gadelha, a health vice minister from Brazil, and in the science and technology field. In Brazil, we have many similarities to UK. You have a universal coverage system that covers 200 million people, and nowadays the life science has a high priority in the national policy. One of the greatest partner of Brazilian strategy is GlaxoSmithKline. This week we signed a contract in tetravalent vaccine. And our perspective is to also attract investment in Brazil, transfer technology, and how can I say, to establish a win-win game in a close cooperation with developed country as UK. I'd like to know how you see this perspective. Thanks a lot.
Well, shall I set the ball rolling on that? I mean, we are very keen to work more closely with Brazil. I was in Brazil with the Deputy Prime Minister last year, and indeed, as you know, we now have a shared fund in which both Brazilian and British scientists can apply for research projects with shared peer review. You have an excellent flow of funding into R&D, and I know that British universities are keen to do more work with Brazil, and we're also, of course, welcome increasing numbers of Brazilian students and researchers here, and we're discussing this with your president the other day. So there is a lot happening, and more will happen when, as we hope, the Prime Minister visits Brazil later this year. But I don't know if colleagues want to comment on that.
Yes, I mean, I think it really comes back to what I was saying about the spirit of partnership and, you know, having the right mindset and the right flexible mindset. I mean, in Brazil, as you know, you have a tremendous amount of vaccine expertise through the Fiocruz Institute. And so essentially what we've done is an arrangement to transfer some of our technology so we can produce in conjunction with Brazil, in Brazil, vaccines for the Brazilian people. And I think that's obviously very powerful for us. It's very powerful for life sciences in Brazil and for healthcare in Brazil. And you know, we're certainly very open to do that in all sorts of other parts of the world. So it's all around partnership and finding the right solution to move things forward.
Any other questions that people want to put? There we are. Yeah.
Art Tucker, Bart's Health and Seahorse. More pragmatic question. How is the newly launched Health Research Authority going to support and accelerate our timelines in medical research in the UK?
What, sorry?
How is the Health Research Authority going to accelerate and support UK medical research timelines?
Right. Yeah. Should we you have, fortunately, in the audience, Sally Davis, Head of R&D in the Department of Health. So, Sally, why don't you're the ideal person to pick up on that.
That'll teach you. So, yeah. Yeah.
So the Health Research Authority has been set up to take over and run in an independent manner a number of regulatory issues relating to health, that is clinical research involving patients and the public. We've started with the National Research Ethics Committee. From announcing it to getting it up running was only 6 months. We have an amazing chair and chief executive, and they're now looking at how they can assist the NHS trusts in doing the bit that is legally theirs, which is saying it's okay to do it in my trust in a streamlined national way. And they are about to discuss and consult on their proposals. They can't take that legal duty away from the trust, nor should they. Chief executives should know what's going on in their hospital and agree to it and want it to happen. But we can do all the checks nationally through an independent authority, the Health Research Authority, so that it is faster and it's streamlined. The other thing I'd like to say is that as of next year, all contracts with the NIHR, with the NHS, and that's £1 billion worth of money, have in it a clause which says that they must, across all their work in that hospital, deliver from receiving a protocol to getting the first patient in 70 days. And all trusts are working to do that so that a single contract in that trust impacts on all their health research's delivery. We're also very excited that we must be the first and only country to have a duty to promote research, a duty to use research evidence and to support research as a legal duty, as an Act of Parliament passed in March that supports David Nicholson in his efforts and everyone else in the NHS to make the NHS not only an innovative culture, but a research and innovation culture.
Yeah, very good. Any other questions from... Yes, here we are.
David Williams, Shire Pharmaceuticals European Medical Director. I'm just wondering, a question for you, Mr. Willetts. Has the consequences of destabilising the pricing structure in the UK with regards to value-based pricing and PPRS been considered in its potential quite significant negative effects in late-phase research and reduction in phase 3 clinical trials?
Well, we see value-based pricing, and later on in the discussions, Freddie and Andrew may want to talk about this more depth, but we see value-based pricing as having the potential to be a significant improvement on the PPRS. And one of the criticisms we sometimes had of the PPRS is it didn't fully capture the wider benefits of a drug, and it didn't fully value innovation. And if you look at the understanding, the sort of the framework for the consideration of the value-based pricing that has been agreed between the Department of Health and the ABPI, it's absolutely clear, for example, that innovation is going to be one of the crucial objectives. So we very much hope that the industry will see value-based pricing as an improvement, though we understand that whilst we move from the old system to the new system, there's never going to be some uncertainty. I don't know, Freddie, do you want to add anything to that? Let's pass the microphone to Lord Howe, Minister from the Department of Health.
Hello, good morning. I'd just like to add one thing, which is that we do see the potential for value-based pricing as giving industry a much clearer idea of the areas which will be most incentivized through the pricing system, and thereby focus their research efforts on those areas that will produce the highest rewards for them in the long term. That doesn't happen through the current PPRS system. The system incentivizes research, but at the end of the day, it's very hit or miss as to whether the NHS accepts a price or doesn't. So we want much greater certainty for industry to plan for the long term and see at the end of it a fair reward for their efforts.
Thank you very much. I think this crowdsourcing of Q&A is working rather well, actually. It's very good. Now, here's a question, and then we're going to see if there's someone in the audience who wants to answer it.
Thank you very much, and thanks also for the invitation. I'm Gwen Ramokopa, the Deputy Minister of Health from South Africa. I'm very encouraged by the global approach of science and research from UK. Because indeed, if we can if we can have scientific breakthroughs anywhere in the world, many people can benefit throughout the world as well. I'm just reflecting on the types of collaboration that would also give, for instance, competitive advantage in terms of the investments that you need to do to get data, just for an example, in South Africa with the HIV/AIDS epidemic, I think we've just heard about 20 million people coming through to test, to know their status and all that over a period of 24 months or so. I don't think that kind of data is available anywhere in the world. But if we structure our collaboration to try and find a solution, certainly the few patients who are HIV positive in Europe or anywhere else could benefit from that wealth of that science from that data. We also have just established our statutory National Research Committee a year ago, and that's also an area for collaboration. And we work very closely with your counterpart, the Minister of Science and Technology, Naledi Pandor. So I hope you've had an opportunity to also meet with her. But certainly we believe this is the right direction, and we hope that you've thought through. Maybe you can share with us areas of possible collaboration where there is competitive advantage, and obviously. Thank you.
Well, I might turn to Lord Darzi in a moment, but I very much like your approach. It's a shared approach, and one of our commitments in Britain is to make more and more of the data that's collected available, obviously in suitably anonymised form. And there was Mark Walpert, who's here from the Wellcome Trust, hosted a fascinating discussion the other week where there were funders of medical research from around the world, about the dozen main medical research funders. And we're looking at the next step, which is that really you thought if all the different research programs publicly funded on medical conditions from all those different agencies, if they were all accessible for further data mining, for further research, that really was a fantastic resource. So the commitment to data mining and open data shouldn't just be within one country. It is only particularly valuable when it's harnessed globally. And what you said about your South African experience is relevant. The other thing I would say particularly about Britain is, of course, when we've got, as we have this fantastic NHS data set, it does mean that finding the patients, if you wish to research in stratified medicine, is easier. We can identify people with really quite rare conditions across the country. And because we're a diverse country, you often find that really conditions that may be affecting people of a particular ethnic background. I think, for example, going to India and agreeing with the Indians that we should do shared research on aspects of type 2 diabetes that seem to be particularly, to which people of Indian ethnic origin seem to be particularly susceptible. And because Britain is a diverse country, they could see Britain as a country with whom we could collaborate and all that. So we've got a resource here, but you've got an excellent resource in South Africa, and we need to collaborate. Is there anything you want to add?
No, I think you've said it.
Yes, question over here.
Hi, Oliver Harrison from Abu Dhabi. So I've been involved in some of the conversations in this space, but I just wanted to touch on healthcare and the exportability of healthcare. Clearly one of the challenges of an NHS system is both the politics and the culture of domestic focus. And I just wondered if the panel can make some comments about how and to what extent you aim to look at both the politics and also the culture of innovation with a view to exporting healthcare expertise around the world.
Thank you. That's been our ambition. We've put minds together. We have two Whitehall departments leading on this, both in UKTI and BIS with the Department of Health, and I think David Nicholson did mention the office, UK Health. I think firstly, there is, the brand of the NHS is a very powerful brand. I get many air miles going around the world to talk about the NHS. However, I think, as the Minister said, there is an issue about the gate when you come in. What is the NHS? The NHS is a system. It's not a single organization, it's a system. When then you say, and you name some organizations within the NHS, they are well known globally. If I could start with London, Great Ormond Street, They're all Brompton, they're all Marsden, you know, UCL, King's College, well-known brand outside. So we need to get our messaging right. And we need a coordinating office, and I know David is very, very keen on this, is how could we provide this is also a behavioral issue, because historically the NHS hasn't really done major business abroad. But many, many of our guests sitting here today from the emerging economies and the emerging economies are very keen to work with us, to learn from us. Let's not forget, the NHS is 65 years old next year. We have not just wonderful global organizations, we also have a wealth of history behind us. We know what works, we know what doesn't work. And also there's a big desire for a comprehensive healthcare provision. Even in the US, the Obama reforms are all about that. So I think we have a lot to offer, and I think the leadership of the coalition government in creating this office, making the right appointments, and through David's leadership in ensuring that providers within the NHS, not just secondary and tertiary, but primary care providers, I think we will certainly meet those needs abroad.
Well, I think that's a great note on which to bring this first session to a conclusion. Thank you all very much for joining us and participating. I'd like particularly to thank the panelists, and I hope you can see that through business, through the NHS itself, through academic research, through government, we're all absolutely committed to working together to back life sciences in Britain, but as a recognition it's a way of contributing to tackling global challenges. Thank you very much indeed. We'll reassemble at 10:45 in individual sessions. Thank you very much.